I'm Dr. Foo Say Kiang. I'm Dean of Faculty of Optometry and Vision Sciences in Sagi University. And basically, in Sagi University, we're offering optometry programs between students become optometrists. So we actually have all those equipments in place to make sure that students go through all this training to know all these products and to become a competent optometrist. Basically, as an optometry clinics, we actually have quite a number of devices, a lot of instruments that are involved. Yeah, this actually is an OCT. So basically, we actually using the instruments whenever that we have a doubt on the patient's retinals or have doubt of patient at the back of the eye. So the patient that we suspect that they actually cannot see because of maybe certain diseases. So usually we will use this Maestro in order to help us to identify is there any pathological sign. When we want to determine the ocular health of the patients, the only things that we have is basically we use camera, fundus camera, we capture a picture. But they do have limitations. We only see the picture is basically just 2D. We may not know at the back of the eye what exactly happened when we want to look at the layer at the back of the eye. So the OCT actually helps us to diagnose quite a number of the cases that which cannot be seen or cannot be detected just purely using camera. So such as cases like we have like macular problems, cases that we have PVD, which is posterior vitreous detachments. We also have patients that have, we call it epiretinal membranes issue, and we also have cases that which is mainly in the, we call some macular retinal detachment. For us, when you use a Maestro2, one good thing is it's fully automated, and plus they have fundus camera as well, so which is actually combined fundus camera and also the OCT. So with this Maestro actually help us to find out more cases, more eyes that have disease, and we can actually refer the patients to seek for the necessary treatments. When I first see this machine, I'm liking it very much in the way because it saves a lot of space for us. It's very compact, it's easier. You don't even need a joystick to someone to operate it. Everything automatic, basically is just one button, and our students like it very much. Everyone's that actually easy to learn how to use this. Basically, you just need a quick demonstrations and everyone will know how to use this. It's quite regularly we use this Maestro especially for glaucoma diagnosis. We also use it for the patient that we suspect they have macular problems, which is their visions cannot be corrected to 6 of perfect visions. So this type of patient usually will proceed to have the macular scan, and also patients that we have seen using fundus camera, we see they have a very huge cups ratio, or they have showing some sign of glaucoma or possible glaucoma, that we usually will proceed to use these Maestros to help us to for further investigations to identify whether these patients that actually have structural sign of glaucoma. So if they do have some sign, and we always will proceed the patients for visual fields to do the perimeter this one, and in order to confirm whether the patient that this disease, and we will refer the patient if we confirm. The most favorite feature that we like to use basically is 3D white. And 3D white, usually when you use 3D white, it's easier for us actually to see the disc and also the macula at the same time. So it's been that when we actually have that report, we want to print out the report, it's easier because it's covered up to this feature and also looking at the macula as well. So it's when we actually have the report, I like it very much because they have everything inside. So if the patients that which is actually we're not sure that they have whether it's a glaucoma, suspected glaucoma, or whether they have macular problem. We mainly want to screen the back of the patient's eye, so usually we go for the 3D white because 3D white gives us all the information that we need rather than just scan these and scan macula separately. We just need one scan and we have all the information that we want.